How has the gluten challenge protocol evolved for celiac diagnosis? Imagine having to eat large amounts of gluten just to find out if you have celiac disease. That used to be the standard way to diagnose it, but times have changed. The gluten challenge protocol has gone through many updates to make the process easier and more accurate. In the past, patients had to consume at least 10 grams of gluten daily, which is about the amount in roughly 1.5 slices of bread, for several weeks. This often caused severe symptoms and was very uncomfortable. Many people found it hard to stick with the challenge because of how sick it made them feel. Now the approach is much gentler. Doctors often recommend lower gluten doses, around 3 grams daily, which is about 1.5 slices of bread. The challenge period has also shortened, sometimes to just 2 weeks, making it less burdensome. The goal is to trigger enough immune response to confirm celiac disease without causing too much discomfort. Advances in understanding how celiac disease works have also helped improve diagnosis. Instead of relying only on symptoms and biopsies, new tests measure immune markers that respond quickly to gluten. For example, certain immune cells called T cells and substances like interleukin-2 are released within hours or days after gluten is eaten. These markers can be detected in blood tests, allowing for earlier and more sensitive diagnosis. Genetic testing has become a helpful tool too. If someone tests negative for the HLA-DQ2 and HLA-DQ8 genes, which are linked to celiac disease, doctors can often rule out the condition without needing a gluten challenge. This saves patients from unnecessary discomfort. There are also new blood tests that can detect immune responses to gluten without eating gluten at all. These tests expose a blood sample to gluten in the lab and measure immune activation markers like interleukin-2. They are less invasive and safer, especially for those who are already on a gluten-free diet. All these changes mean fewer people need to go through long, painful gluten challenges to get a diagnosis. It helps patients avoid suffering and makes it easier to confirm celiac disease accurately. The evolution of the protocol reflects a focus on patient comfort while maintaining reliable results. Instead of high gluten doses over weeks, doctors now use shorter, lower doses, or relying on immune-based tests that are faster and safer. This shift makes the process more manageable and supports better management of gluten-free living from the start.